You may remember that 2 years ago, it was the issue of adult social care that unravelled Theresa May's general election campaign. She may be gone, but the question of how we properly fund the places that care for so many of us has not. We don't yet know what the parties will have to say on the issue in their manifestos, but the scale of the social care crisis means no party can ignore it. More cash may be one answer, but Newsnight has had first sight of an in-depth study of the sector that has found huge amounts of cash never getting near the front line. Here's Deborah Cohen.
Rosswell Care Home in East London used to be where survivors of the Blitz spent their final years, but no longer. In June last year, residents here found themselves looking for a new home. Theirs was closing. The site's landlord and the private firm who ran it had failed to agree a new lease. They had 56 days to move out.
I suddenly got a phone call at work in April, which was about just over 3 months since my mother had been in the home, saying that the home was going to close in June.
Hetty Lazarus was a teenager during the Blitz. She entered the home in December 2017, had to leave it 6 months later and died earlier this year.
She was 93. She was obviously getting on, but she wasn't actually sort of senile or had dementia at that stage. You put someone into a nursing home, you certainly expect that there would be a longevity of, for her.
For some, what happened at the care home here resonates far beyond Walthamstow. It's a story about how much of our care sector is at the mercy of the whims of private equity firms and how hundreds of millions of pounds a year are hemorrhaging out the sector.
Councils will have access to new funding of £1.5 billion for social care next year.
The Health Foundation think tank has told Newsnight that in fact £4.4 billion per year will be needed by 2023 just to stabilise the market.
All we have now is a sticking plaster of £1 billion, which will leave this sector in the same sorry state as now.
Newsnight has had first sight of the largest study ever undertaken into care home finances, an analysis of the accounts of 830 adult care home companies.
Even allowing for private providers to make a reasonable profit, this report says that about 10% of the £15 billion in fees that providers receive from residents and local authorities is never reaching the front line. The new £1.5 billion pledged by the Chancellor, that's how much is already leaking out.
They've shone a light on how some of the financial giants of the care home sector are spending hundreds of millions of pounds worth of fees on repaying their debts and maximising their profits. The study by the Centre for Health in the Public Interest, part funded by Unison, reveals a pre-tax and deductions profit rate of £7 per 100 for small and medium firms running care homes. But for the 18 largest for-profit providers, that figure is more than double. Former senior health regulators are behind the report.
Hundreds of millions of pounds a year leak out of the care home industry in the form of rental payments to offshore landlords, in the form of profit, in the form of management fees, and in the form of rental payments, again to offshore companies. Lots of debt has been loaded onto large care home companies by the companies that bought them and then loaded the debt onto the company, and that means in some cases that 16% of all the money which is given over to care for a resident each week disappears out of the system to pay off those high cost loans.
The average interest rate paid by the major care home operators in 2017 was 11.8%, which means that they were paying over £235 million a year in interest. And that's money that could be going to frontline care, but isn't. And there are estimates suggesting that that interest financing model is pushing up the cost per week for a resident in a care home by anything between £100 and £200 a week.
Four Seasons refused to comment on the closure of Ross Wild. They are now trying to restructure, having gone into administration. For those in the homes, it means uncertainty.
It's not sustainable at all. I mean, one of the most worrying aspects is that all of the major care home operators, the big four, have been up for sale for an extended period of time, and none of them can find a buyer. That tells you all you need to know about just how risky this model is and how fragile the industry is. And if one of these major care home chains fails, you're going to have the security and the welfare of tens of thousands of vulnerable old people on your hands.
The opacity of the current care home system meant the study was hard to do. The CHPI is pushing for more transparency so residents, who account for more than half the fees, and the public know how their money is being spent.
They have a piece of legislation in America which is designed to require all of the care home companies which are providing state-funded care home services to account for where all the money which they receive ends up. And we're suggesting that that is something which should be introduced in the UK.
Nothing has changed. Nothing has changed. We are offering a long-term solution for the sustainability of social care for the future.
At the election 2 years ago, a controversial policy on social care worked against Theresa May. The issue has not gone away, but it might need more than a bit of cash to fix it.
That's it for tonight. Katie's here tomorrow. Until then, good night.